All right. Hello, everybody. This is Making the Most of Medicaid, 1115 Waivers and You. Full transparency, we are re-recording this webinar. We did it live in mid-February and forgot to hit the record button. So now I am recording the slides for you so that they can live on our YouTube channel and you can have access to the information. So if you were at the original webinar and you're seeing this and you're like, Jules, your hair's a different color, you're wearing a different outfit, what gives? That's why we just forgot to hit the record button like silly geese. Now obviously, there won't be audience questions or anything because I'm recording this by myself in a Zoom room. So that's what's up. But anyway, hello, I'm Jules Good. I'm the State Advocacy Manager at ASAN. And today we are going to be talking about Medicaid 1115 waivers. So, this might be a review for some of you, but just so we're all on the same page, let's review what is Medicaid. So, Medicaid is a program run by the government to help people pay for healthcare and services. It helps people who don't have a lot of money, it helps people with disabilities. A lot of disabled folks need Medicaid to pay for healthcare and services. When we say healthcare, we mean things like doctor's appointments and getting medication. When we say services, we mean things like having someone help you with daily tasks at home, maybe getting rides to work, things like that. So, who makes decisions about Medicaid? Medicaid is what's known as a federal state partnership program, which means that the federal government, so the government for the whole United States, makes some choices about Medicaid, and then state governments make some choices about Medicaid for the Medicaid programs in their state. That also means that it is jointly funded. So the federal government pays for some parts of Medicaid services, and state governments pay for some parts of Medicaid services in their state. At the federal level, the Centers for Medicare and Medicaid Services, or CMS, that is the group that is in charge of Medicaid, makes a lot of choices about Medicaid, makes sure that states follow the rules for Medicaid. And CMS is part of the Department of Health and Human Services, which is a larger department that's in charge of healthcare at the federal level. So 1115 waivers are a way that states can make changes to their Medicaid program's rules. And that can look like a lot of different things that we're going to talk about throughout this presentation. But that is the main thing that 1115 waivers do. So what are 1115 waivers? First of all, what's a waiver? To waive a rule means that you are telling someone they don't have to follow that rule. Um, Now, there are federal rules for how Medicaid programs are supposed to work at the state level, but sometimes states want to try new things or they think that a federal rule doesn't work for the people in their state. And so they can apply for a waiver to not have to follow that rule. And the reason that this is allowed is because we want state governments to innovate and find new ways to make Medicaid better. And sometimes that means going outside of the established rules. You might also hear 1115 waivers get called 1115 demonstrations, means the same thing. So, what are some good things that states can do with 1115 waivers? Um, This is not a complete list. These are just some examples we've seen in 1115 waivers over the years. But states can use 1115 waivers to expand who can get healthcare with Medicaid, so letting more people get healthcare with Medicaid. Um, it might let a state pay for more kinds of services with Medicaid so that people don't have to pay as much for those services. It might make Medicaid services and supports better for the people who use them, so improving quality of services and supports. Um, States have also used 1115 waivers to help people get health care during an emergency. So, for example, if there's a hurricane and a lot of people are hurt, a state might use an 1115 waiver to be able to provide emergency care to those people who were affected by that hurricane. Again, these are just a few examples, but a lot of the 1115 waivers we see fall under some of these categories. So just as states can do good things with 1115 waivers, they can also do some bad things. Now, legally, states are not supposed to use 1115 waivers to make it harder for people to get health care. But unfortunately, they do that sometimes. And so, as much as we are fighting for good things in 1115 waivers, we also have to sometimes fight against bad things in 1115 waivers. So, some examples of some of those bad things. A state might try to use an 1115 waiver to reduce the number of people who can get health care with Medicaid. They might make eligibility requirements more strict, so people have to follow more rules to be able to get Medicaid. They also might make people pay more money for Medicaid services through things like co-pays. And we don't like those things because we want healthcare to be accessible. That's how it's supposed to be. But again, this is not a complete list. These are just a few examples of some ways that states might try to use 1115 waivers to make it harder for people to get health care. There are certain things that a 1115 waiver cannot do. And this is decided on in like federal law. So, first of all, 1115 waivers cannot change how state governments and federal governments share the cost for Medicaid. Those rules can only be changed by the federal government. So, a state can't submit an 1115 waiver um, to say, like, hey, we don't want to pay as much money for our state Medicaid program. Only the federal government can decide to do that. 1115 waivers cannot waive any part of the Constitution. The Constitution is, the big law of the land. So 1115 waivers have to follow the laws of the Constitution. Um, and there's a new restriction on 1115 waivers um, that came from CMS that will take effect next January, so January 2027. Um, and that rule says that an 1115 waiver cannot make Medicaid cost more money than a state's Medicaid program would usually spend. It's something called budget neutrality. Um, we won't get like super detailed into that, but if you have questions about it, feel free to reach out. It's just something to be aware of in our advocacy. So, how do state governments apply for an 1115 waiver? Um, ooh, touched something that made a noise. Sorry. So it's important to remember here, oftentimes when we hear the word waiver, we're thinking about like HCBS waivers, right? 1915 waivers. Those are waivers that individual people apply for to get supports and services. 1115 waivers are not applied for by individual people. Sorry, that was like Yoda grammar. Individual people do not apply for 1115 waivers. Only state governments apply for 1115 waivers because they impact the Medicaid program for that whole state. Um, so every state government has a part of their government that helps run their Medicaid program. It's called the state Medicaid agency, and they're the ones that usually work with 1115 waivers. A state Medicaid agency is a part of a state's Department of Health. State governments can have more than one 1115 waiver in the mix at a time. So they can have a mix of like active 1115 waivers that have already been approved and then apply for more. They can apply for multiple. They can have multiple active ones. They can also ask the federal government to change a waiver that the state already has. So if they've applied for one, it got approved, and now they want to make changes for it, that's another thing they can do. For Native American tribes, 1115 waivers work a little bit differently. So, a tribe is a group of Native American people who are connected to the land that they live on, and people in a tribe usually share a language and a culture. Tribal governments make choices about laws for people who are members of their tribe. And tribal governments also have tribal Medicaid agencies that make choices about 1115 waivers. So, just like state governments make choices about Medicaid for the people of their state, tribal governments make choices about Medicaid for the people of their tribe. So how do state governments apply for an 1115 waiver? Um, they have to submit a written application, and some of the questions on that application are things like, What will the waiver do? Does it make a new part of Medicaid or change a part of Medicaid that already exists? How will the waiver help the state meet their goals for their Medicaid program? What federal Medicaid rules is the state government asking to waive? Is it legal to waive those federal Medicaid rules? How does the waiver change who gets Medicaid or what services they get? And how much will the 1115 waiver cost? How does the waiver change who pays for Medicaid or how people pay for Medicaid? So there's a lot of details that state governments have to answer or write about when they submit their application for an 1115 waiver. So once they submit the application, HHS and CMS will decide if they will approve the waiver, if they'll let the waiver program happen or not. 1115 waivers usually last for about 5 years, but a state government can ask for longer. They can ask for an extension. When a state applies for an 1115 waiver, the state and the federal government both have to tell the public that they are doing that, that they're applying, and that's called a formal notice. The public can then share their thoughts at meetings with the government called hearings, which we'll come back to later. And while they while a state has the waiver going, while they're running programs under the waiver, they have to do something called monitoring and evaluation. Monitoring means collecting information to see if the waiver program is doing a good job. And evaluation means seeing if the waiver did what it's supposed to do. And state governments have to collect that monitoring and evaluation information and give it to CMS regularly throughout the waiver period. So that was a lot of like dense information about what 1115 waivers are and how they work. What do we do with it? Why does this matter to us as advocates? That's what we're going to talk about now. How can you help your state make the most of 1115 waivers? So I'm going to outline this process and then we're going to go through each step in a little bit more detail. So first, you're going to find out if your state is applying for an 1115 waiver now or in the near future. Then you're going to learn about what your state wants to do with the waiver. Then you're going to think about what your state should add or get rid of in its waiver application, the things that you like and don't like about it. Then you're going to write a public comment, which we will talk more about in a minute here. And then you'll submit your public comment. And then there are some other extra bonus steps that you can do to really be a superstar advocate in the world of 1115 waivers. So, step one, we're going to find out if our state is applying for an 1115 waiver now or soon. There are a few ways that you can find this out. Unfortunately, there isn't like a one-stop shop, super easy website that makes it clear where or when states are applying for waivers and what is in the waivers they're applying for. So your best bet is to talk to the people in your state who are familiar with this process and can explain it to you. And there's kind of three main groups that we would go to for that. One is Centers for Independent Living, or CILS. CILS are places that help people with disabilities make our own choices about our lives. There's at least one CIL in every state. And we'll put the link for where to find the contact information for your CIL in the description of this video. Another place you can go is your State Council on Developmental Disabilities. It also gets called the DD Council for short. DD councils help to protect the rights of people with developmental disabilities in each state. Every state has a DD council. We'll also put the link for where you can find the contact info for your state DD council in the video description. And then lastly, there's your state Medicaid agency. Like we said earlier, every state has a Medicaid agency that usually is directly handling this waiver stuff. It is usually housed under the health department for your state, and we will put the information for how to find and contact your state Medicaid agency in the description as well. So then we have to find out what our state wants to do with the 1115 waiver. And the way that we do that is by reading the state's application. Every 1115 waiver application is going to be different because every state Medicaid program is different. Unfortunately, these applications are far from plain language. They can be very hard to read. It's like very dense policy and legal language. So again, we want to go to the people in our state who deal with that language and know what it says and can explain it to us. Going to your SIL, DD Council, or state Medicaid agency is also what we would recommend here. If for some reason you try your SIL, your DD Council, your state Medicaid agency, and you can't get answers from any of them, ASAN can also try to help you understand your state's 1115 waiver application. You can email me. My email address is there on the screen, jgood@autisticadvocacy.org. I may not always have capacity to help you super in depth with every application, but we will do our best to point you in the direction of resources that can help you to advocate for the things that matter to you in your state's 1115 process. So then the next step, once you know what's in your state's application, is to think about, okay, what do I like about this application? What do I not like about this application? What's going to help people in my state versus what's going to hurt people in my state? Um, Again, if you're having a hard time understanding what is in the application, what your state is trying to do, SIL, DD Council, Medicaid, ASAN, all great resources that can help you kind of get a handle on that. Um, it's really important that you understand what is in your state's 1115 waiver application before you do advocacy about it, right? We want to make sure that we know what we're talking about before we write a public comment or attend a hearing. Doing that background research is very important. So once you've got a grip on all of that, we're going to write our public comment. ASAN, we talk about public comments a lot, but if you haven't heard of a public comment before, it's basically a way for everyday people to let the government know what they think about something. For 1115 waivers, there's the state public comment process, and then there's the federal public comment process. The state one, is the place where you're gonna share more like details about what you think should be or not be in your state's 1115 waiver. And so that's the really important one to start with. It's also the one that comes first. So most people send their public comments as a letter. But your state might have special rules about public comments need to look like. So they might say it can't be more than 3 pages long. Your state might say everybody has to put their full name and address on their public comment. It's important to follow those rules because if you don't, then a state might just like not read your public comment, which would be a bummer because you spent all this time researching and writing it. So you can also ask your SIL, DD Council, state Medicaid agency about the rules for your state for submitting public comments. So now we're going to break down the parts of a public comment. And we're going to hopefully be able to, yes, okay, great. Go back and forth between slides so I can show you each of these parts as I'm explaining them. So first is the letter heading, and that's the address of the people in your state who collect the public comments and the date that you're sending in your public comment. On this slide, we have a sample public comment that I fully made up just to be able to show you the parts of public comments. So the letter heading is this part at the top left in red. It says October 3rd, 2025, so that's our date. Lori Weaver, Commissioner, New Hampshire Department of Health and Human Services. That's the person it's addressed to. And then 129 Pleasant Street, Concord, New Hampshire, 03301. That is the address of the person who will be reading it. Next is the introduction. So this is where you greet the person who reads public comments, say a little bit about who you are, and say how your state's 1115 waiver ideas will affect you. So that's this part in orange here in the kind of top mid left. It says, Dear Commissioner Weaver, my name is Ron Trosper. I'm an autistic adult. I've lived in New Hampshire my whole life. I get health care through Medicaid. So there you're explaining a little bit about who you are. And then it says, this 1115 waiver would threaten my access to healthcare and make it even harder for me to make ends meet. So there you are explaining how this waiver would affect you right up at the top. Next is section headings. Section headings are just a way for us to organize our ideas. We want to make it as easy as possible for people reading comments to be able to like find the most important points of what we're saying, or if they're going back and rereading a comment, making it easy to find the information that they're looking for. So these section headings are highlighted in yellow here in the section where we're talking about Medicaid premiums, making people go without healthcare. We have a heading that says Medicaid premiums make people go without healthcare. And then in this section over here, we're talking about rural communities. We have a section header that says Medicaid premiums hurt rural communities. So just a way to organize the info. Next is evidence and sources. So evidence is a fact that proves that a thing you're saying is true, and sources show where you got the evidence from. So these links in blue, and we have one highlighted in green over here. That's an example of evidence linked to a source. So when you're saying something, that's a fact or a statistic, if you're sharing data, like saying how many people do something or how many people are impacted by something, you want to back that up with a source to show the reader that you didn't just make that up, that that is in fact true. And so linking to where you got that information is a great way to do that. And then last is the closing. So this is where you say, hey, thanks for reading my comment. If you want to give the reader a way to contact you, you can. Sometimes people like to make themselves available for like follow-up questions, but you don't have to do that. And then lastly, you just include a sign off in your name. So sincerely, your name, or however you want to sign it off. So our closing here is thank you for taking the time to read my comment. I'm happy to answer any questions you have. You can email me at this fake email address, sincerely, Ron Trosper. So again, leaving your email address or contact information, totally optional, but just wanted to show it in the example because some people like to include that. So we've researched, we've understood what's happening with our 1115 waiver. We've thought about what we like and don't like about it. We've written our public comment. Now it's time to submit our public comment. Um, every state has different steps for submitting public comments because why would they make it easy? Again, your SIL DD Council State Medicaid Agency will hopefully be able to help you know what the steps are for your state. Make sure that you follow all the rules that your state has when you submit your public comment, because if you don't follow the rules, then your comment might not get read, which would be a bummer. So rules about length, formatting, submission deadline, all of that stuff is just important to make sure you understand and follow. So you've submitted your public comment. Hooray. What now? Um, Submitting your public comment is just one way to fight for the changes that you want to see in your state's 1115 waiver application. There are some other ways that you can do that as well. So the process we just went through was about submitting a public comment to your state comment portal. You can also submit a public comment to the federal comment portal. So a state will say, hey, we're submitting this 1115 waiver application. Tell us what you think. CMS will also say, hey, this state is submitting an 1115 waiver application. Do you think we should approve it? And so you can leave a comment to that effect on the CMS comment portal. And again, your state SIL, DD Council, Medicaid agency should be able to help you find that. You can go to hearings about your state's 1115 waiver. So every time a state applies for an 1115 waiver, they're required to have at least two public hearings. So you can go to a hearing and read your public comment or read other testimony about how the 1115 waiver would affect you or people that you care about. And then you can help other people do advocacy about 1115 waivers. So, showing them this webinar, sharing the resources that ASAN has created about this. We have a whole plain language guide that like really breaks this process down in detail and shares more about what exactly 1115 waivers are. You can share that guide with people. The more people we have engaged in this process, the more likely it is that we will be able to protect good things in our state Medicaid programs and fight off bad things in our state Medicaid programs. So, that is all of the information I have for you. One last thing is we do these webinars with support from the Grassroots Project, which is a fabulous organization and group of like other disability orgs doing similar work about Medicaid and home and community-based services. And they have a survey that they ask us to share at the end of our webinars and resources and such, um, where you can let us know what you thought, how it went, what was good, what was not so good. Um, and that helps us continue to get grant money from the Grassroots Project, which we love. And then importantly, it also helps us learn how to make our webinars and our programs better for you. So if you want to share your thoughts about this video, we'll put the link for this survey in the video description. And we really appreciate you taking the time to fill that out. Um, I'm going to, I can't take your questions live because this is a pre-recorded video. But if you do have questions, after watching this, feel free to shoot us an email, info@autisticadvocacy.org. Those emails will get forwarded to me, and I will, get back to you and hopefully answer the questions that you have. And with that, I will bid you farewell. Thank you so much for watching this and for learning about 1115 waivers.